Recording. Yes. So I'll go ahead and get us started. Welcome everybody. I am very excited for today's speaker, and I hope you all are too. And also happy Friday. It's almost the weekend. And it's been homecoming, so I know I've seen some of you all around. We are doing the homecoming tailgate tomorrow, so I hope to see all there as well. But I won't hold us up too long. I will go ahead and introduce our speaker, and let me um, that's one second. There we go. Okay. So I'll go ahead and introduce Dr. Zellmer, and then I will hand it over to her. So it's an honor to introduce today's speaker, Dr. Alicia Zellmer, who is a physician, educator, and advocate for thoughtful and compassionate care. Dr. Zellmer is a board-certified internal medicine physician who trained at the George Washington University Hospital in Washington, D.C. She earned her doctorate of medicine from the University of Central Florida and also holds a bachelor's degree in biology from here, the University of West Florida. She's also an honors alum, so we're excited to have her. Currently, Dr. Zellmer has returned to her academic roots, serving as an instructor in the honors program here. In this role, she brings her real-world medical experience into the classroom, inspiring the next generation of thinkers and leaders. She does this by teaching a seminar for the honors program, where she introduces students to the medical humanities, which is a broad field of medical education that focuses on how engaging with the art and literature can help with medical professionalism. Beyond her clinical and academic work, Dr. Zellmer is also known for her creative approach to medicine. Through her social media platform, she explores the intersection of science and storytelling, using prose to reflect on the human side of healthcare. Please join me in welcoming a passionate physician, educator, and communicator, Dr. Zellmer. Go ahead and flip the camera so that she can see it all. And then whenever you're ready, Alicia, we're excited to hear from you.
Hi, you guys. I don't know if you can see me too, or also just my screen, but
So we see. Oh, actually, wait. That might be mine.
it's nice to meet you all. I'm excited to give this lecture. This is one of my favorite topics. As my students who have taken the medical humanities honors seminar know, I think that death is a very taboo topic, but it shouldn't be. So I love the fact that we have this opportunity to talk about it, which is very exciting for me. So, can everybody see my screen okay? Guess just nod because I can only see you but not hear you. All right, I'm going to take that as a yes. All right, so we're going to talk about some lessons on death, and specifically, we will be talking about them through a medical humanities lens, which means I'm going to bring both my background medical experience, but then also I'm going to apply it to different forms of both literature and other popular media. And in this case, that's going to include Broadway musicals because that's one of my favorites. And yes, I'm Dr. Alicia Zellmer, and thank you, Elizabeth, for that wonderful introduction. Okay, so we're going to start just by talking about why and how is death explored in literature? So why is death explored in literature? Well, literature handles everyday life, and death is a part of everyday life. While we uh, while we don't it may seem strange for me to say that death is a part of everyday life because most of you being young are not directly affected by death. But as you get older, you will be, but also there's many, many indirect ways in which we are affected by death as well. We see it in social media, we hear about it, especially with the very connected world that we live in nowadays. We are even more indirectly affected by it on an everyday basis. And if you go farther back in time, where death was much more common, you can much more understand how death would have been a common subject that would have been handled in literature. Um, So another reason is that often in art, we demonstrate our culture, whether intentionally or unintentionally. And one of those ways that we demonstrate our culture is through depictions of death. And not necessarily the dying process itself, but often the mourning and grieving process, funeral processions, and things like that. Different people, places, and religions have handled death differently through time. This is one of the ways of how death is explored in literature. There really is a lot of reflection of cultural beliefs. We've learned a lot about funeral rites and processions, for example. One of my favorite examples from the Viking times, Old Norse. We learn a lot about that from the sagas, for example. And this is one of the ways death is explored in literature. Okay, and like such things as love and war, it's an emotional topic. So, emotion is often a part of art, creative art, and yeah, so that's one of the reasons that death is explored in literature. And as I said before, it affects everyone, either directly or indirectly, constantly. Okay, and this one's a interesting and important one. We have nobody to report back to us on what it's like. Um, I don't say this without exception because I know that there are some accounts of people, literature actually about people who have died for a little bit and do report back on their experience. But I mean, really, we have no definitive, with certainty, scientifically proven evidence of what it's like. So that creates a kind of curiosity. And whenever there's uncertainty around a topic, one of the ways in which we engage with that uncertainty is trying to express ourselves and express our ideas and explore our ideas of what we think could be what's going on. So that's one of the other reasons why death is explored in literature. Okay, so let's jump into the lessons. Lesson number one, doctors can't stop death. So I would love to show you guys the Broadway musical number from Beetlejuice, which I'm going to use to talk about this lesson, but I don't think we'll have time for that. But I am going to give you the song titles so you could listen to them yourselves afterwards if you wanted to. So it may sound strange for me to say that doctors can't stop death. Maybe your immediate thought to that is, no, absolutely they can. I know for a fact that, I knew so and so and they had this disease. And then they saw a doctor and the doctor treated them and saved their life. Or maybe you understood exactly what I was getting at right away, in that I'm saying that doctors can't permanently stop death. Even if you save someone, you're only temporarily saving them. Life is finite, and we cannot know when it's going to end. And even though we have medicine, which is incredible and life prolonging, it doesn't actually stop death. So, the song from the Broadway musical, The Whole Being Dead thing, and the Broadway musical is quite different from the movies, but I absolutely love the musical and the message that it kind of carries. So we're going to go through some of the lines from the musical. So when he's singing this opening number, he says, "That's the thing with life. No one makes it out alive." So that kind of boils down to the message that I just shared. That is the thing with life. Whether we like it or not, you will at some point die. And even if you get treatment and have your life saved at one point by a doctor, that's not the doctor preventing death. Okay, death is taboo, but it's hardly something new. This is important too. So you're probably wondering, why am I reminding you of your mortality? Why am I reminding you that we're all going to die? Well, the reason that I remind us of that is because when we hone in on the fact that we are going to die, it becomes something that scares us and we feel a lot of uncertainty around it. And in response to that, we often just stop talking about it. It becomes something that is taboo. But I like this line, which counters that. It's hardly something new. It's something that has been going on for centuries and centuries. And we'll come back to that thought of how that means we just need to talk about it. But he goes on to say, there's nothing medical professionals can do except maybe just bill you. I always thought that line was very funny. Yes. So obviously, medical professionals, like I said, can help prolong your life. And I want to shift to the focus also later in my presentation of how they can do more than just prolong your life. There is a whole nother dimension to medicine than that. Um, but they can't stop death, in other words. Okay, so from the cradle to cremation, death just needs a little conversation. So this is what I wanted to come back to with the whole death is taboo, but it's hardly something new. So why do I say this? Because it just needs a little conversation. When we talk about these things, some of the uncertainty around it starts to fade away, and some of the fear around it starts to fade away, and it becomes something that we can deal with more directly without emotional dysfunction and emotional dysregulation. Okay, so point number two, delaying death is not giving life. And the piece of media that we're going to talk about here is Hadestown. It is actually another Broadway musical. So you could look up the song after this if you wanted to, because it's so good. Okay, so I'm going to let you think about this for a second. Delaying death isn't giving life. What does that mean? Well, it depends on what is life. How do we define life? So let's just assume we have, for the sake of this presentation, the definition of death as that fixed point in time in which you no longer are living. But that doesn't necessarily mean that life is that point in time in which you are living, because what does it mean to live is what I'm getting at. Is living simply surviving? In other words, not being dead, just continuing to exist on this earth, or is it thriving? And I don't ask this to try and persuade you towards one or the other. It's actually just something that we should think about. And that reason will become clear. Okay, so this song is A Gathering Storm. I'm just going to give you a little bit of background on the Greek myth for those of you that aren't familiar with it. But I will say, when I was at UWF in the honors program, we kind of got an interdisciplinary minor. And one of the things that we had to do was take some literature courses, and one of those was Greek literature. So I hope you guys still have to do that. But if not, here's a recap. So Hadestown handles the Greek myth of Orpheus and Eurydice. So Apollo, the Greek god Apollo, gives Orpheus a lyre, which is a musical instrument, and he becomes the best mortal musician. Persephone, which is Hades' wife, when she has to return to the underworld, at the end of each summer, she takes spring with her, and spring is symbolic here for life. So that's why we have fall and we have winter, because as soon as she goes back to the underworld, everything starts to die, and she doesn't come back till the spring. For this story, Orpheus must write a song to bring it back. Supposedly, because he's the best mortal musician, if he writes this very beautiful song, it will entice Persephone to come back early from the underworld and bring spring with her. But while Orpheus is distracted by his song, Eurydice, which is his lover, and his fiance, is starving, and he doesn't notice that she's starving. And because she's starving, she is approached by Hades, and she sells her soul to him. And what does she sell it in exchange for? She sells it in exchange for survival. So you've probably heard a lot of the deal with the devil kind of stories. And actually, a lot of them deal with getting something beyond survival. They usually deal with some kind of promise of fame or fortune, or something that actually is more in line with quote unquote living as in terms of thriving, but she actually sells her soul in exchange for survival. So we're going to kind of explore that. Okay, Hey Little Songbird. This is another one of the songs, and here are the lyrics. So Hades says, always a pity for one so pretty and young, when poverty comes to clip your wings. So kind of just situating ourselves here. Like I said, Eurydice is starving, and she's starving because she's poor. So there is a socioeconomic factor there. And then he says, and the choice is yours if you're willing to choose. So what choice is he offering her here? Basically, he's offering the choice of you can either, stay here and die, or you can sell your soul, quote unquote, and survive, but you will be making a sacrifice. So we're getting into that question of living as surviving versus death. Because what if the option, the spectrum is not just living is surviving or living is thriving, but it's also death, living is surviving, living is thriving. So this will make more sense in a second. Okay, so here's how it makes sense. Because this is a common medical situation that actually patients find themselves in, specifically terminally ill patients. So let me contextualize this for you using an example. So, say for example, somebody has cancer with a terminal prognosis, which means that it is believed that they will die. That's what a terminal prognosis is. And usually they're given an amount of time, some kind of time range, 6 months to 2 years, for example. I'm just making up this example. And one of the treatment decisions that they have to make, and usually that the physician offers to them, is whether or not they're going to receive life-prolonging treatment or life-enhancing treatment. Sometimes they can receive both, and of course, that is the goal that they would receive both. But a lot of the time, they do have to make a decision, at least a little bit between these two. And let's kind of talk about what that means. So, life prolonging treatment. These treatments are geared towards giving the patient increased quantity of life, so increased survival time. So, say that they have a range of 6 months to a year of survival. This treatment is going to be geared towards giving them that year of survival. And one of the ways that you could do that using the cancer therapy would be chemotherapy, for example. So the chemotherapy then increased their 6 months, so they're living for a year. Like, this is no guarantee, but this is the assumption. What is the trade-off? The trade-off then could be that they risk having painful side effects, and their quality of life goes down dramatically for the remaining amount of time that they're alive. So that's the one side of it. And this is the living as surviving side of it. And then life-enhancing treatment. So life-enhancing treatments are focused on quality of life. These are geared towards making the patient comfortable. So once again, looking at that same prognosis, say they have 6 months to a year to live, and the range could, of course, be way bigger than that. But this would say, okay, I'm going to accept the 6 months that I have to live, but I want to be comfortable and I want to maintain as close to my normal quality of life as normal. And so an example of this would be starting a pain medication regimen that helps keep them comfortable, but precludes them from getting the chemotherapy that they were going to get. An even more extreme example is that starting the pain regimen actually, hopefully this isn't too complicated, but depresses their nervous system a little bit and actually risks further limiting their survival. So these are the two extreme ends of the spectrum. Like I said, most patients try to do some combination, but this idea of having to make any kind of decision and this idea of life being more than just continuing living, or focusing on turning life into thriving is often a new concept for people. So I just like to bring up this question of what does it mean to live? Does it mean simply to survive? And is that our goal? Or does it mean to thrive? And like I said, there really is no right answer. The important thing, especially for physicians, is to bring up these questions to the patient so that they understand what kind of decision they're making. A lot of the times, because physicians are humans too, we make the assumption that patients would prefer life prolonging treatment. I think also not just make that assumption, but it feels like a more tangible and tackleable thing to do to try and give the patient treatment and increase their survival and give them more time to live. But unless you actually give the patient these options and help them to understand that question that they're answering, living versus as surviving versus living as thriving, it's not really shared patient decision making, if that makes sense. So back to Hadestown. So Eurydice's choice. In Hadestown, so say in her case it isn't cancer, she is dying of starvation, hopefully. Not something that is common in our country, of course. But the decision that she makes is increased survival. What are the side effects that she risks? In this case, interestingly, in the play, she actually does kind of mirror the side effects that you would experience going through some kind of treatment that increases your survival rather than focusing on uh, life enhancement. So she has physical symptoms because she has to join Hades' labor team. So she has the pain from the labor. And then she also has the psychological symptoms uh, because she leaves her partner Orpheus up in the mortal world. And we can just kind of boil those down to having the mental and emotional side effects that come with taking on any kind of rigorous treatment. So, like I said, she goes down to Hadestown and works for Hades building his wall. So, I'd also just like to clarify, you may be thinking her choice wasn't between uh, life enhancing treatment and life prolonging treatment. It was between life prolonging treatment and death. That is also absolutely a part of that decision that patients are making. Because if you go back to the cancer example, the patient who has the cancer, for example, may say that they still don't want to do the life prolonging treatment, even though there isn't much enhancement that can be offered, simply because they don't want to endure the suffering that comes with the prolonging of life. And once again, that's a choice. I just want to introduce you to the complexity of the choices that we make when we think about life and death, and especially in a medical context. Okay, great song. Why We Build the Wall. This one actually can be read through a different lens in our modern day world, but I'm going to guide your reading of this. So Hades says to all of the souls that he's collected that are building this wall and basically just doing pointless labor, he says to them, "Why do we build the wall?" And they respond, "We build the wall to keep us free." And he says, "How does the wall keep us free?" And they say, "The wall keeps out the enemy." And he says, "Who do we call the enemy?" And they respond, "The enemy is poverty." So let's kind of read this metaphorically. So why do we build the wall? So building the wall here is kind of a metaphor for taking that life prolonging treatment, making that choice that life is surviving. And in this case, doing it arbitrarily so. So basically doing it just to survive for the sake of prolonging life. And what is the point in doing this? Well, according to this, the wall keeps us free. And how does it keep us free? It keeps out the enemy, and the enemy is poverty. And you could fill in poverty with any kind of thing that, like poverty, disease, etc. And so that's kind of just a fill in for the enemy is death. But is death the enemy? That's kind of the question that we have to ask ourselves, or is that question much more complicated when you get down to the nitty-gritty of uh, living as surviving, living as thriving? So, just something to think about. Okay. Is death the enemy, or are fear and uncertainty the enemies? The less we fear death and the more open we are to uncertainty, the less we'll see death as the enemy. So let's kind of dig into this a little bit. When we fear death, what exactly are we fearing? We're fearing the uncertainty of not knowing what comes after death, right? That's part of what we're fearing. A lot of people actually are not fearing that even. They're just fearing the suffering that's associated with death and the uncertainty to precede that comes with not knowing how much or how little we will suffer prior to the moment of actual death. So a lot of it can be boiled down to uncertainty. The more we talk about these things, the less uncertainty there is around them, and the less taboo it is to talk about that uncertainty and to talk about death itself. It begins to become more of something that we see as a natural end of life, especially when we frame it into that first lesson, for example, that no matter what, there will be a natural end of life. With that reframing comes an understanding, or at least an openness to death's inevitability. This openness can help us shift our mindsets from fearing death and prolonging life at all costs. And I put that in italics because I don't want you guys to think that I am against prolonging life, because I'm absolutely not. I am emphasizing the idea of prolonging life at all costs. In other words, choosing survival because we don't have this kind of openness to the idea of any alternative. So, prolonging life at all costs, and instead discussing the benefits of life-enhancing treatments in a comfortable last few months. It's a big focus of palliative care, which I find to be a very interesting field. But yes. So the bottom line here is that being able to discuss both options openly, whether you are a provider, and even if none of you are ever going to be providers, also as a patient or a caregiver of a loved one or just a patient's loved one, this is practicing patient-centered care. Because you know all the options, you understand all the options, and you know that the only option, it isn't just prolonging life at all costs. Okay, another example. Mary Shelley's Frankenstein. If you haven't all read it, that's okay, because we all know this story. So, one of the things in this novel is to give life, or rather to stave off death, at all costs. This was a big focus of the Enlightenment era, the Romantic era, and I mean the post-Enlightenment era in which Mary Shelley wrote Frankenstein. There was this belief as science was emerging that they could tackle all these questions that before seemed unanswerable. And one of those was kind of this obsession with how are we going to conquer death? And so one of the ways that she kind of discusses this issue in Frankenstein is that she, reanimates this corpse and gives him life. And this would, of course, be a method to stave off death, because if you died and you could reanimate a corpse, then you would just bring them back to life. Is this the same thing as giving quote unquote life? Once again, that boils down to what your definition of life is. So, Dr. Frankenstein, Dr. Victor Frankenstein, he bestows life upon his creature, only to ignore the consequences of his work and his creature's suffering. That's kind of the whole focus of the novel, but I'm just going to hone in on the fact that the creature does suffer. So he basically has no quality of life. From the moment that he is given life to the end of the novel, he has absolutely no quality of life. He lives to survive. And the metaphor or the analogy that we can see here is a doctor, Dr. Frankenstein, offering a life-prolonging treatment in lieu of any kind of life-enhancing one, not offering any kind of life-enhancing treatment, not discussing what this would look like, etc. So, is that life is really the question that comes out of that. So this is a quote by Frankenstein's creature. I learned that there was but one means to overcome the sensation of pain, and that was death, a state which I feared yet did not understand. So, I'm not going to interpret that quote for you. You can interpret it as you wish, but in other words, this was the conclusion that he reached. Okay, lesson number 3. This one comes from The Mask of the Red Death, which is a short story that I always teach in my seminar. And that lesson is that death doesn't discriminate. What does that mean? So now there's this Netflix show about Poe's stories, and the first one is The Mask of Red Death. So if you want to see it all kind of modernized, the story is maybe lost, but it's very short. You could read it. So here's the story though. When a plague, this plague is called the Red Death, that's a made up disease, breaks out, Prince Prospero locks himself away with, naturally 1,000 of his closest friends to live safely hidden away in luxury. Surprise, surprise, the Red Death comes for them all anyways, and they all die. So what am I saying when I say death doesn't discriminate? All right, let's look at a couple quotes. Prince Prospero and the gentlemen, after they had entered, brought fire to heat the iron of the gates, to make them close so firmly that nobody could open them. Here they could forget the sickness, the Red Death. So Prince Prospero is inviting us to believe that there is a way in which you can become immortal, or at least become immune to sickness simply because you have a certain status, a certain wealth, a certain popularity, etc. Here they could forget the sickness, him and his 1,000 friends. Prospero had supplied everything they needed for pleasure. All these were within the wall, and within the wall they would be safe. Outside the wall walked the Red Death. Yet, one by one the dancers fell, and each died as he fell. And darkness and decay and the Red Death ruled forever over all. So what is the message here? Can we escape death if we have enough money, if we have enough friends? The message that Poe is trying to put across is no, we can't. So what can we learn from this? Death is inescapable. Disease doesn't discriminate, no matter who you or your friends are. I will come back to that caveat. So in other words, I think the honing in on disease doesn't discriminate. It's an interesting thing to think about because we often envy celebrities, for example, or actually even just people in our lives who we feel like have very perfect lives. But actually, disease doesn't discriminate. It doesn't pick people because they're unpopular or in other words, it can afflict everybody. But let's talk about this caveat because it's actually really important. So the caveat here is that socioeconomic factors do count for something. They did delay Prospero's death after all. So when he locked himself away and his 1,000 friends, they actually did delay them being afflicted and dying from the Red Death much more than those that were outside the wall. So, as we know, if you do have certain socioeconomic conditions, for example, if you're poor or if you live in unsafe conditions or you don't have good access to healthcare, you actually are at a greater risk of being affected by disease. So, this is called healthcare inequity. And there's actually certain social determinants of health that we assess, and it's actually a part of kind of patient care. And it's that side that you don't think about because it's not diagnosing a disease and then treating that disease, although it becomes a part of the treatment. So assessing for economic stability, being able to afford care, education, in this one, having access to good resources and being able to understand those what those resources are offering, what the treatment options are, having a certain degree of health literacy and being able to understand. Health access and quality. So it's not just having access to care, but having access to good care. Certain people can pay for certain, for example, wealthy people can pay for concierge medicine where they're having a one-to-one doctor and they can access it whenever they want. This absolutely gives you a greater defense against disease, for example. Neighborhood and built environment, so living somewhere safe where you're not exposed to disease. And then social and community context. So once again, I just mentioned that to say that even though disease doesn't discriminate and death certainly doesn't, it is something that can and will afflict everyone. There actually, is that caveat of there is healthcare inequity, and it is something that needs to be addressed both in a public healthcare sphere and a personal, provider to patient sphere. And that's just something to be aware of. Okay, lesson number 4. Don't forget about the living. So I'm working on a new course curriculum right now that handles the Harry Potter series, and it's because that new what's it called, TV show is coming out, and I feel like there's a lot of literary pearls in here. So, Dumbledore, don't pity the dead, Harry, pity the living. So, Harry Potter and the Curse of the Living. When death has struck, who remains? Well, the survivors, right? The people who have to grieve. I was showing my husband this list. Harry Potter loses his parents, James and Lily, his classmate, Cedric Diggory. He witnesses the death. His godfather, his mentor, his pet, his good friend, many of his good friends, Fred, Lupin, Tonks, etc. Many of those are witnessed. And the point I'm making here is that even though you may not, eye to eye witness all of these deaths, you will at some point in your life survive someone else. That is just the natural order of things. And in a healthcare setting, often we deal a lot more with the survivors than we do, well, of course, with the dead. Once the dead is left, once the dead is gone, the survivor is left. So the very first death that I actually witnessed when I was a medical provider was someone who died of cardiac arrest. I was just working in the hospital that Sunday. And interestingly enough, I actually didn't cry when I saw the death, or even a little while after that. It wasn't until I had to break the news to the family that I found myself actually overwhelmed with emotion. And it's because there is that additional dimension of death where you are not actually where you're not just facing the one who has died, but you're actually facing those who are still living and have to continue to live with that death. That's a very heavy topic, but I just want to add that in as one of my lessons because it's very, very important that when death affects us, it affects all of the living, and especially those who are close to them and have to survive them and have to grieve them. So basically what I included here then are some lessons on grief from Dumbledore. So grief is very painful and it's very personal. It looks different on everyone, and that is okay. So it seemed impossible that there could be people in the world who still desired food, who laughed, who neither knew nor cared that Sirius Black was gone forever. So this is actually a very common sentiment that you will hear from people who have survived a loved one. It's important to grieve. Understanding is the first step to acceptance, and only with acceptance can there be recovery. So science actually shows that those who open themselves to grieving and doing so right away and opening themselves to the emotions surrounded with the death, rather than pushing off death as a topic, not talking about it, not thinking about it, especially when it affects them personally, That latter group who does the pushing off is much more likely to have trauma that they experience related to that death, and to have complicated grief and to have to grieve it for much, much longer, rather than allowing that grief to transform into a more regulated emotion like remembrance and love. So it's important to grieve. And comfort can be found in their memory. I think this quote is beautiful. You think the dead we have loved ever truly leave us. You think that we don't recall them more clearly than ever in times of great trouble. Fun fact for those of you who do know the Harry Potter series, the Thestrals are kind of a symbol for the memory of their loved one. They can always be seen by those who have lost someone that they loved. Okay, and then finally, death means something different to everyone, as I said before. So I just wanted to real quick return to the very first slide where I said that death is depicted differently in different literature throughout time, different societies, different cultures, and just show you the variety with which death is depicted. So take, for example, the Vikings and Norse mythology. We have a lot of the Icelandic sagas, which we can use to kind of get insight into how they viewed death. So, in the Icelandic sagas, the Viking warriors marched happily off to battle in hopes of dying and going to Valhalla. So they had a very positive outlook on death. There really wasn't that taboo that we experience around it today. Now, if you weren't a warrior, you might not be so keen to die because you would go down to Niflheim, the abode of hell. So a lot of the people would prefer to die earlier, go to Valhalla, get to feast and party every day. Otherwise, if they died of sickness and old age, they would have to go to hell. Here's an opposing view from Joseph Heller's Catch-22. Open your eyes, Clevenger, you saurian snaps. It doesn't make a damned bit of difference who wins the war to someone who's dead. The enemy is anybody who's going to get you killed, no matter which side he's on. Bottom line here, this person does not want to go to war. They don't want to die in war. They would not happily do so if they did die. So just two very different outlooks on death from literature. Okay. A lesson from the philosopher Seneca. Death, a punishment to some a gift, and to many a favor. So I just want to end by saying how one perceives death is different for everyone, but we must respect all values and beliefs, no matter how much they differ from our own. Thank you.
Okay, here we go. Thank you, Alicia. That was wonderful. We're still having a couple of audio issues here in the room, so we're kind of working through that. But in the meantime, I'm gonna open up the floor for.
Can you speak real quick, Alicia? I'm gonna test the audio. Okay, that didn't work. Try one more thing.
Can you hear me?
Good deal.
Oh no, I didn't even see that you guys were having audio issues. I'm so sorry.
No, they use their phone. What's your name? Percy. Percy. He had it's the room audio. No, we were able to hear you. Just through someone's phone. But anyway, thank you.
Okay, good. It would be very awkward and perhaps a little funny, depending on where you cut into the presentation.
Prepare with cameras. Y'all have any questions or comments?
I have a question.
Yes, ma'am.
In some instances, does it make sense to prolong your life if you know that all you're gonna end up with is suffering, like day in and day out, you don't have your faculties? I mean, is it really worth it?
Great question. So I can't answer that for you. But that's kind of what it boils down to, right? That is, once you actually get to the nitty-gritty of that question, that's what you have to decide. So in other words, you're kind of doing an assessment of your quality of life. So one of the ways that I would frame it for patients is, and this is going to be a little bit kind of blunt, but say your quality of life right now, maybe some of you are at 100%, that would be amazing. But let's say, for example, your quality of life right now is 80%. I would say to the patient, for example, doing this chemotherapy will bring your quality of life down to maybe 30% while you're doing it, just because you'll be, and I'll give them reasons because they can determine why that percentage exists. You know, you'll be immobile, your breathing will be affected, your mental faculties won't be there, etc. But after you're done with the chemotherapy, with the regimen that you'll be on, it'll go back up to maybe 60%. It won't be 80% again because you still won't be able to do XYZ, but it'll be 60%. And then I'll ask them, what percentage are you willing to live at in order to do this treatment? Because when you can kind of reframe it in that way, you can then answer your own question that you asked. Because I can't answer that question for them. I can only decide for me what would be worth doing a life prolonging treatment, what degree of suffering I'm willing to endure versus what degree of quality of life I want, as opposed to just accepting the life enhancement treatment and undergoing some decrease in survival time. Does that answer your question?
Yeah, that was very good, because you made me see it in a way that I didn't. I guess something you made me think about too is, like you said, you have to think about the degree. My thing is, okay, if you had like you said, a terminal illness and you know you're gonna die anyway, that's different from, okay, get some treatment and you're gonna live, but it might not be to the quality that you was before. So yeah, you made me think about something else. That was good.
Yeah, absolutely. A lot of people don't think about the quality of life, how that will change. They have this expectation that they'll do chemo and maybe it will suck a little bit. But then afterwards, they're going to be right back to their regular everyday life. And there will be no change in quality of life. Um, so yeah, that really is just something that is important to think about. But for some people, that really doesn't change anything. They're still completely interested in doing life prolonging treatment only. Yeah.
So if you think of like a colon cancer patient, they might have to wear a bag. I mean, their bowel movements for the rest of their life will be in a bag. But
Yeah.
no one, that's gonna be a change in your quality of life, but you should be able to do a lot of things. But you definitely will never be back at 100%. My own grandmother, she chose not to go that route. And her quality of life was worse because she chose not to take the bad option. And that was the thing. So she made a bad choice for herself because she was quite vain and didn't want to be embarrassed. But point was, she made the wrong choice and her quality of life was worse than if she'd chosen that. So I mean,
Yeah,
I've seen this with my family.
that's a great example too. Absolutely. Sometimes, I mean, life enhancing treatment in that case.
Any other questions?
I feel like in a lot of like modern popular culture, especially like superhero movies, that kind of thing, death is almost like treated as like it's just a temporary condition. Like characters get resurrected all the time. Do you think that's reflective of like something in our culture, like almost like an anxiety about death?
I couldn't quite hear the question.
Is that the line correct?
And it's basically, she was asking about superhero movies with like how characters are just constantly dying and being resurrected, and asking if that's kind of reflective of maybe anxiety towards death.
Oh man, I hate superhero movies. Totally unrealistic. Definitely sends a bad message to our society. I still didn't quite catch the whole question, but I do think that they reflect a negative image and this idea of I don't know, just it doesn't encourage openness to actual conversation around the complexity of death.
I think there are a couple online Yeah, I think we had a couple in the chat as well. Let's see. One of them was, do you think in the United States we are less accepting of death as opposed to other cultures?
Ooh, I love this question. So, actually, I would say it varies depending on what culture you're talking about. Um, and so I can't speak to every culture, but for example, I'm Japanese American and I also speak fluent Danish and spend a lot of time over there. And there really is a wide degree of difference between even just those all developed societies. So, for example, we actually are a lot more religious. You may find this surprising, a lot more religious than, for example, Denmark, in which they are superficially Christian, like officially, but there's very few actual believers in the religion, and for that reason, death is actually more taboo because there is even more uncertainty around the afterlife, and that fear and uncertainty around the afterlife can lead to greater fear of death. Um, so I wouldn't actually necessarily say that we are less accepting of death. I would actually say we're on a spectrum because then you could also go to different cultures where, to use an extreme, the Old Norse culture in Viking times, where death is actually something that they welcomed and see as an honor. Uh, and that would be definitely different from us as well. We don't, willingly walk into death and seek it out. So it's really a difficult question to answer, but it varies a lot around the world.
I would like to chime in on that question. I think, I wouldn't say we're less accepting of death, but I think we would try to prolong it more because we have more resources. Like you said, it does depend on your circumstance and where you live at. If you live in a poor country, in unsafe conditions, you don't have access, that makes a difference. But America is one of the richest countries. So I do think a lot of times we do try to prolong that.
And
Yeah.
we have cultures within the United States. I mean, it's just, there's different, we're still a melting pot of cultures and different religions and national origins. And so, yeah, I mean, I think it depends on what city block you might be on in the United States, and then we also have, tribal, they're tribal nations too. So they all take different looks on it. I see the comment here about your inclusion of musical and other media in explaining lessons on death. I was a senior in high school when Beetlejuice came out, the first one. And it totally, I remember leaving the theater like, this is a classic. This is an instant classic movie because no movie before that portrayed death in that way that I had ever heard of. When I was growing up, Frankenstein was kind of a joke. The movie, we didn't really read the book, but it was kind of a joke. And I say that because the people create their own Frankensteins. You hear that about that stuff. So the deeper meaning was kind of lost because of all the different Frankenstein movies. That Bride of Frankenstein and all that kind of became, like a satire of itself. I do appreciate you bringing that up.
Yeah, absolutely. I like the movies, but I love the musical. The musical is a medical humanities masterpiece. So if you can watch some of the songs on YouTube, especially the whole being dead thing, and just see if you could journal next to it and write down all the interesting associations that you notice about these little tidbits that he says about death, it's a very enlightening experience.
I think one other question that I think would be good, and then we'll be out of time, but this question's, do you believe that people should discuss the realistic ideas of death with young adults and children as opposed to sugarcoating what occurs and not explaining it?
That's a very personal question. Do I believe that they should do this? Yes. But should you ever tell someone how to parent their children? I personally don't think so. Um, and there is a lot of complexity around that question itself because like I said, death is something that is different for everybody. We all come from different backgrounds. In other words, we were raised differently, religiously, culturally, ethnically, etc. We have different views that we're going to bring into it that are both colored by our personal experience with death, um, but also what we've seen and how it's portrayed in the media. I do really think that people shouldn't sugarcoat death and that they shouldn't lie to their children about uh, the fact that it exists. In other words, I don't think we should create kind of like superhero movies. I don't think we should create this idea that that life goes on forever, simply because that will then become an idea that you have to later contradict. And I mean, I don't want to get into all the psychology and science behind this, but that can destabilize any kind of relationship if you lie about something that is so foundational to life itself, aka the existence of death. But
I
if
think,
you personally talk to your child about your beliefs on religion and everything, that is a parenting thing.
yeah, I think it depends on the situation. Yes, it should be the parent's choice. But if you're talking about an 80-year-old great grandmother who lives 500 miles away versus someone in the household, a parent or a sibling passing away or with a disease, I think those are totally different situations. But,
Yeah.
And you can ask 20 people how to approach that situation, you're gonna get 20 different answers.
Yeah.
And that's just parents reaching out to parenting, everyone has a different opinion on it.
I would boil it down to don't lie about death and the existence of death, but the way that you handle the explanation of the afterlife is very personal.
Thank you so much again, Alicia. This was wonderful. Y'all can join me in giving her one more round of applause. Thank you. Next week, we are going to be back here, same time, same place. I hope to see y'all. It's going to be a health panel. So we're going to have some representatives from the Department of Movement Sciences and Health, coming to talk to us a little bit about how we can keep ourselves healthy so that we can have more time to enjoy all the musicals and movies and all of the things Dr. Zellmer shared with us today. So
And come out to Honors Tailgate tomorrow. If you haven't heard about it, come on out. I'll see y'all later. We found out.
thank you so much for being here.